Good afternoon, Finsdale. I am Mihiraa. Let's start the warm-up session. What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
I find the best way to handle the stress of being a nurse is through meticulous organization and attention to detail, by making lists and prioritizing what needs to get done throughout my day. I find that tasks that might seem overwhelming all at once are much more manageable. This also makes it possible for me to stay calm and remain focused on what needs to be done when unexpected situations arise.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating, and am equally comfortable working alone.
Would you say you're a team player?
Yes, I am flexible and I work well under a variety of conditions and circumstances. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivation and am equally comfortable working alone.
How to communicate with patients effectively?
To communicate with a patient effectively, you should greet the patient with a smile and their name. This helps to create a positive and respectful first impression and shows that you care about the patient as a person. Take your time, even if you're in a rush. This helps to convey that you are interested and attentive to the patient and that you value their time and input. Try to avoid distractions, interruptions, or multitasking while communicating with the patient. Importantly, explain things as simply as you can. This helps to ensure that the patient understands what you are saying, and avoids confusion or misunderstanding. Use plain language, avoid medical jargon or acronyms, and give examples or analogies when possible. Finally, ask your patients if they understand everything to check for comprehension, and clarify any doubts or questions.
You can now start your OET-speaking roleplay.
Thank you for allowing me to examine your hands, Mihiraa. I would like to have some more information to get a clear picture of your condition. Can you tell me more about your condition?
Sure, nurse. It started about a week ago. At first, it was just one small bump, but now there are several, and they've gotten worse.
Okay. How often do these appear, and have you had any similar issues before?
No, this is the first time I've had something like this. They just appeared suddenly. I tried squeezing them to get rid of them, but they have been getting more painful each day.
Oh, I see. It is not advisable to squeeze them. Instead, there are other treatments you could have tried. Have you used any medications or treatments for this so far?
Yes, I've been using some over-the-counter antibiotic ointment, but it doesn't seem to be helping much.
Thank you for that information, Mihiraa. Now I would like to get some basic information about your general health. Have you experienced any recent illnesses, or do you have any known allergies?
I had a cold a few weeks ago, but nothing serious. And I'm not allergic to anything that I know of.
Have you been exposed to any chemicals or anything unusual that might have caused this condition?
Not that I can think of. I've just been doing my usual daily routines.
All right. Mihiraa, after examining your hand, I can confirm that the pustules are indeed infected. The presence of discharge indicates that the infection is quite severe. While this can be a common condition, it's important to address it properly to prevent it from getting worse. Because of the severity, I strongly recommend making an appointment with a doctor. This is not just for immediate treatment but also to rule out any underlying issues that could be causing the infection. A health check will ensure we cover all bases and get you the best possible care.
I understand that you're concerned about the severity, and that's why you're here. However, nurse, I'm really just looking for some treatment to cure this condition. I don't want to spend a lot of time waiting to see the doctor and get it checked. Can you please just dress it and give me some tablets? That's all I need.
I understand your concern and your desire for a quick solution, Mihiraa. It's important to address your immediate discomfort, and I can certainly help with dressing the pustules to provide some relief. However, I must stress the importance of seeing a doctor for this condition. Infections like this can sometimes indicate underlying issues that need more than just topical treatment or oral antibiotics. A doctor can provide a comprehensive assessment and prescribe the appropriate medication, which might be stronger than what we can provide here. They can also check for any underlying problems that could be causing the infection, ensuring that it doesn't recur or worsen. I know the thought of waiting for a doctor's appointment might seem inconvenient, but your health and safety are paramount. Getting the right treatment now can prevent complications that might require even more time and treatment later on. Please consider making an appointment to ensure you get the best possible care. Is there anything specific that's worrying you about seeing the doctor that I can help address?
That's fine, but I'm just a bit worried about taking time off work.
I completely understand your concern about taking time off work, Mihiraa. Your schedule is important, and we want to make this as convenient as possible for you. We can help arrange an appointment at a time that fits your availability, perhaps early in the morning or later in the afternoon, to minimize any disruption to your workday. Additionally, we can accommodate appointments relatively quickly, so you won't have to wait long. We can prioritize finding the earliest practical appointment for you. Your health is crucial, and addressing this infection now will help ensure it doesn't lead to more serious problems that could require even more time off work in the future. In the meantime, continue to keep the area clean, and avoid squeezing or touching the pustules. If you notice any worsening symptoms, let us know immediately. If there's anything else we can do to make this process easier for you, please let us know. Your well-being is our top priority, and we're here to support you every step of the way.
No, that's all. I guess you're right.
Great. So, can we go ahead and schedule that doctor's appointment for you?
Yes, let's do it.
Excellent. I'll arrange the appointment for you.